definitely going to read those studies on infanticide. I think that's an amazing comparison to make about the lives of women before the 67 Act came in and what it was like in Ireland to live with unwanted pregnancy compared to after. And you rightly refer to the 67 Act in your presentation as the Irish Abortion Act, and that without that we would never have had access to abortion in this country. And it was illustrated earlier on where an island stuck out there that has no access to abortion. There's limited and variations on the theme of access to abortion across Europe. And if you were in Poland and needed help, you could get on a train to Germany or to Austria. But in Ireland, as an island separated, and a poor island for a long time, now quite a wealthy island, we're still in the dark ages. So I'm going to definitely read those studies, and thank you for pointing me in that direction. Just anecdotally, I think there's been more ways to skin a cat in the history of this country as well, because we were on a walking holiday in Donegal learning about plants, names of them in the Irish language, and there's this lovely little plant that was traditionally picked, and they made tea from it in order to abort an unwanted pregnancy, and that's been going on for 100 years and had a beautiful old Irish name. And I brought home lots of it. Anybody wants a cup of tea, if just letting them know out there that if they want a cup of tea and they need help. What I do want to quiz you about is the Protection of Life During Pregnancy Act, and this implication of the psychiatrists, 2 psychiatrists and an obstetrician, that a woman has to get through in order to say, I'm suicidal and I need an abortion. Now, you mentioned that most of these psychiatrists, or some of them, and I'm not quite clear, maybe you could repeat it for us, never did that kind of work. And by that, I think you meant saw women with mental health issues who were pregnant. That's your job, and you've been doing that work in Holles Street with hundreds of women every year. But the psychiatrists who, under the PLDPA, are now doing that kind of work would not be used to it. So what I want to tease out is the PLDA, in your opinion, fit for if practitioners like psychiatrists are doing a job that they've never done before in these very serious circumstances with women whose lives are at risk, and then they're not used to it and how they deal with it. And obviously, if you do a job for a long time, you get used to it. But if you're starting off from the position that you're not used to doing this kind of looking at women who are pregnant with mental health issues and who request an abortion because they feel suicidal, do you think that the PLDPA fits the bill, pardon the pun, for what its purpose was designed for? If that is the case, if given the stretched resources we have in mental health in this country, psychiatrists, the 2 psychiatrists that a woman may have to see are not used to the work. And secondly, do those psychiatrists have a choice about doing that work? Are they forced to do it? Are they told by the HSE, today you've got to interview 2 women who are suicidal because you're employed by the HSE? And do they have an opt-out if they don't want to do that sort of work? And lastly, my question to you is, do you believe that, although you said earlier on, and I would agree with you, that rather than go through 2 psychiatrists and an obstetrician and the loops and jumps that ridiculous act has forced on women who have mental health issues, it would be easier for a woman to go to Britain and have an abortion rather than have to go through all that? Well, then who does actually, on the main, have to go through all that? And I'm going to ask you, is it girls? Is it young people who are below the age of being independent and ability to be independent financially? Is it very poor women? And is it in particular refugee women or women who are in direct provision and can't leave this country? And does that reflect badly on this country, that as well as penalising all women by not giving them a choice over their own reproductive system, we then further penalise a cohort of women, particularly those who cannot leave the country because of their immigrant or refugee status?
Okay, a few questions there, but maybe I'll just start by talking about a sense of humour. Sorry that the deputy is gone, but sense of humour is very important in my job, and sometimes with the women I'm seeing, sometimes after having talked about a very distressing thing, being able to have a joke and a laugh is sometimes one of the best things we can do. And even laughing and joking after some painful losses and pregnancy losses is part of it. It's a bit like at a funeral. People will laugh and joke, and that's just part of the human response in situations like this, and healthy rather than something to be offended about, I hope. Yes, so obviously that bill was enacted at the time with the best of intentions to try and deal with all of the results of the European Court of Justice's directions and trying to address some of the issues involved, that mental health had to be involved, and in those circumstances suicide was, as you know, the most controversial part of that bill. I remember being on radio at one stage saying, you know, when there was a suggestion there should be 12 involved. One of my children still says it was a relatively proud moment to see my name on a poster on Pierce Street on a newspaper, the Evening Herald. Psychiatrist calls this idea a joke. Because I thought originally it was a joke that 12. It got down to 3. But I still said all along, you know, there simply are not enough people to do this work, and how is it going to work, and how would it be appropriate? The wording of the Act simply says, because of the acknowledgement in the country there's not enough psychiatrists, and of course there are psychiatrists. I mean, okay, there's the 3 Dublin maternity hospitals have part-time psychiatrists. You know, the major unit in Cork has a liaison psychiatrist who does a lot of work in this area. But still, throughout the country, there's very, very few. So the requirement for a psychiatrist, they must have treated a woman with mental health problems in pregnancy to be allowed to do this work. So they have to be a consultant and have treated a woman. Now, that's sort of the pragmatism of the legislation. But that's because to get enough people around. Are there enough people with training? Of course not. There were requirements put in afterwards that you know, they would be trained. But one of the key issues, for example, is the nature of that training. And I suppose particularly there's none working in maternity hospitals. So, for example, I will see a woman who's thinking who would wish to have a termination of pregnancy, but she'll have no idea of gestation herself. She'll have no idea about the difference between an emergency cesarean section at 24 weeks and the scar that's going to be in her body versus if she waits a few more weeks and it'll be a different one altogether. She'll have no idea of various things, but equally the doctor assessing won't have. And the amount of experience and time you take to deal with that. So yes, there's simply not enough training, there's not enough people who are used to doing this, because for all the training you do, theoretical training, it's actually practice. It's seeing again. I learn all the time, every day from the patients I'm seeing. And that's what we learn from. And so yes, unequivocally, it really doesn't work. And because it's so clumsy, that's why the vast majority of women are going to come nowhere near us, and appropriately so. Because it's just an unnecessary and unhelpful procedure. With regards to, and therefore they have to travel, with regards to who, I don't have a breakdown of the very small number who had that. Certainly the very highlighted ones have been some younger people and at least one refugee. I haven't seen a breakdown of the numbers simply because I haven't been involved in them.
So one question there, are doctors obliged to do this sort of work? No.
Oh no, everybody can opt out if they wish, and certainly one of the circumstances being that doctors have opted out. A number of doctors have opted out because they felt they didn't have the qualifications or the experience, or they simply didn't want to do it, and there have been real difficulties in just finding a second psychiatrist, or 2 psychiatrists if the first psychiatrist didn't want to certify either. So it is a real problem.
Thank you.
Thank you, Professor. Thank you, Deputy. Deputy O'Sullivan.
One very practical question first. Can you treat under 18-year-olds, or is that distinction between child and adolescent psychiatry and adult, does that apply in this situation? If they're pregnant and under 18?
Pragmatically, if they're in Holles Street and they're expecting a baby, I'm not too worried about what age they are. But certainly, if there was a case of termination, for example, I would want a child and adolescent psychiatrist to come in that situation.
So my main question really is around, and you know, I was really struck by the humanity of your presentation and the fact that you clearly, you know, understand the individual